most likely cause of this is a condition called femoral acetabular impingement, better known as FAI, and this condition has been much more better understood over the last probably 10 to 15 years with the movement forward of MRI. And in fact, if you have a look at this particular video that I will show you, this is the hip joint here. This is the femur and the acetabular cup, or the ball and socket joint. What ends up happening with an acetabular impingement is you get a small notch of bone called a cam defect that forms on the femoral neck, and this is usually congenital, and it also can occur the older we get. And you get this small spur of bone that forms on there, and unfortunately when you move the hip joint, this piece of bone then jams up into the labrum, and it can cause a secondary labral tear. And while it progresses, you don't just get a tear of the labrum, but as you can see from the subsequent part of the video, we also start to see some degeneration and some jamming of the cartilage also through here, and the cartilage in this part and this part. So the bony part here produces a cam defect. It also jams the bone and causes some degeneration. And this video here beautifully illustrates some of the damage through the articular cartilage and the labrum. And one of the problems with this condition is that it tends to be progressive. And I use the example of somebody like Andy Murray. So Andy Murray had hip pain originally, the famous tennis player, when he was about 23 years of age, and it started with this etiology of a cam defect. It then progressed on to produce a tear of the labrum, and then progressively the articular cartilage damage. There's been a lot of data and research in recent years looking at identification of that cam defect and taking that out and shaving it arthroscopically quite early. One of the challenges with this condition, especially with FAI, is it is progressive. And unfortunately, a lot of the patients we will see will tend to be in their 40s, and it's progressed too far. So they now have early stages of osteoarthritis, so that articular cartilage degeneration, and the labral tear. And so the horse is bolted. So for me, it's important with these conditions to identify them early and stop the aggravating activities. Interestingly, there's a couple of take-home messages with FAI. Don't stretch the hip, and yet a lot of textbooks and physios will get you to stretch the hip, but the stretching it up into a flexed position, taking it up, actually jams it even more, so avoid that. Number two, glute strengthening programs to make the buttocks stronger seems to be useful. Interestingly, corticosteroids, injections that we used to do into the hip, not only do they probably produce more problems down the track, but they probably also are non-effective once there's more degeneration. The other take-home message with this is that often the MRIs underestimate the amount of articular cartilage or arthritis in the hip joint. And while we're on that point, if you've had an MRI, which is really useful to help identify the extent of labral damage and articular cartilage damage, you also need a plain X-ray. The plain X-ray helps us see where you are on the spectrum. If the bones are really close together, it shows you that you're much further down the track than just looking at the MRIs. So take-home message number one with these, try and identify them early. If you start getting pain in this area, we start with some physio, and anti-inflammatory is particularly useful orally. Injection, probably not. Avoid the aggravating activities, including stretching, deep squats, high load activities, running, and then you see how these things progress. I'll be honest with you, the treatment of femoral acetabular impingement from a conservative perspective is limited. It's a tough thing to treat, and I've treated them for 30 years, and they tend to come backwards and forwards depending where they are on the spectrum. So the first time you see the physio or the doctor, it's a really good idea to understand where you are on that spectrum. Are you like end stage, ready to have an operation, or is it something we think we can treat? We can get a bit of an idea. The big telltale sign for this is night pain. If you get night pain, it's probably towards the right side of the spectrum that this is not something that's going to do well with conservative treatment. When it comes to the assessment of these things, even in Singapore, it's challenging. And when I talk to the surgeons, they'll say it's a very challenging area to know whether they would do an arthroscope to try and clean it and trim the cam defect, or whether you'd have a hip replacement. And it's been expressed by the surgeons here and also back in Australia. I have to say it's a very challenging diagnostic area and what to do. In fact, we've seen a flip at the moment in Singapore where the surgeons are backing off these completely and not doing an arthroscope because the results are quite poor. So hopefully that gives you a little bit of information about femoral acetabular impingement. Thanks.